as I mentioned, I'll kind of, let people in here. Welcome everybody who's joined us so far. And sorry again about the technical glitch, but I guess that happens when we have technology. I'm Molly Perry. I'm an ADHD parent coach, and through my time in doing classes with parents and meeting one-on-one with parents, the one thing that they've kind of shared loud and clear with me is that they want some more resources. And so I'm thrilled to be able to bring a couple of staff members, Emma and Alicia from Sunny Days Therapy, to you tonight. They have a lot of information to share with you as a parent on this journey. And all of us will agree, everybody who's in on this event tonight will agree, an engaged parent is really the most important person in this whole process. And by those of you joining tonight to learn more in ways that you can help your children, I think you're going to find tonight to be very beneficial. So I am going to turn it over to Alicia and Emma, and you guys can go from here. And then at the end, we are going to have some time for questions for both of them and also for myself. So again, welcome everybody, and let's get this baby rolling.
All right. Thank you, Molly, for that great introduction. So my name's Alicia. I'm an OT at Sunny Days.
And my name is Emma, and I'm a speech therapist at Sunny Days.
So we are excited to be here tonight and share our professions with you, but also our passions for working with children and families, and give you guys hopefully a little bit more information than you had previously on the benefits of speech and OT and what they are and how we work with children and families to help them really participate in things that they want to do and need to do. So I'm excited to share with you guys tonight. So we'll kind of chat a little bit about our overview tonight.
Perfect. And I also want to thank everyone else for joining us and taking that time out of your evening to kind of listen to us and hear what we have to say. So we will do a quick introduction of ourselves as well as our professions, and then we'll take a closer look at exactly how we can help you and help your child. And if this seems like something interesting to you, if you want to find out more, we are going to talk a little bit about that assessment process. But ultimately, our goal is to leave an ample amount of time at the end so we can answer any questions you have.
Absolutely. Oops. Perfect. So as I mentioned, my name is Alicia. I'm an occupational therapist with Sunny Days. I'm also the clinical supervisor of the Minnetonka location. I graduated with my undergraduate degree from the University of Wisconsin-La Crosse, and then completed my master's in occupational therapy from St. Kate's in St. Paul. And I've been working at Sunny Days for the past 3 years. And it's been a really great place to work and grow. And I've met a lot of great families and kids from being at Sunny Days. I love being a pediatric OT. I initially wasn't sure exactly what OT was, but I determined that it was going to be my career path from a fun little career fair that we had in high school. And I was gravitated towards this person that had all these cool toys and activities and adaptive equipment set up. And I went right over to the table and kind of engaged with the therapist, and they explained, I'm an OT. I work with kids, and there's all these different things we can do to help them gain skills through play. And I was like, I'm sold. So I've been in pediatrics ever since I graduated, and I love, every part of my job as a therapist. And then as a supervisor at the clinic, I get to work with therapists across the clinic and families during the intake process, as well as work on community outreach projects. So that's kind of how I connected with, was looking at resources in the community. So that's a little bit about myself.
And my name is Emma Voss. I will be coming up on 2 years this summer of being a speech therapist, as well as 2 years at Sunny Days. So my whole speech therapy career has been at Sunny Days, which I've been so grateful for. I graduated from the University of Wisconsin-Stevens Point, about an hour from my little small hometown, and then did my graduate program at the University of Northern Iowa. And to be completely honest, when I was in high school, my foods teacher looked at me and goes, I bet you'd be a pretty good speech therapist. So I kind of looked more into it, and the idea of just being able to work one-on-one, especially in that outpatient setting of working one-on-one and with families, just made me so excited. And I love that aspect of play and just being able to take a kiddo's interest and put the language into it has just been truly so great.
That's awesome. All right, just to go over a little bit about our clinics. So Sunny Days as a whole was founded in 2006 by Kelly Peters, who is also an occupational therapist. We currently have 3 clinics: Minnetonka, which is the clinic that I primarily work at, Albertville, St. Michael, which is where Emma works at primarily, and we also have a Waconia clinic as well. So we've been providing therapy to the community for about 16 years, and we really serve clients throughout the lifespan. We see kids as young as 3 months old, sometimes 11 weeks old. We recently had an infant that was 11 weeks old we evaluated, all the way up through 18. Sometimes we see kids that are 19, 20, young adults, depending on their needs. If we're a good fit for working with them, we really see kids throughout the lifespan. So we provide speech and OT services, and we really pride ourselves on providing therapy that is meeting the client's needs, the family's needs, and really providing therapy in a non-judgmental manner. So we really work closely with families throughout the process and make sure that every step of the way the family is involved in the treatment planning.
So
Right.
like I said, am a speech language pathologist, and we are able to evaluate, diagnose, and treat every portion of communication, including that social communication, understanding, comprehending, as well as what is being spoken. We're able to help with that cognitive, concussions, that neuro portion, as well as voice and swallowing, everywhere from babies in a NICU to adults in nursing homes. We really are able to see a large scope of people.
Yeah, same with OT. Really, the type of client, like Emma mentioned with speech, it depends on the setting we work in as far as what types of interventions and what types of diagnoses we might work with. But in general, OT's scope is pretty broad, but we are able to work on a lot of skills that ultimately promote the health, independence, and quality of life of the client, to be able to help them engage in the things that they want to do and need to do. So obviously that varies a little bit throughout the lifespan, but when we're talking about children, obviously one of their main occupations or their daily activities is play. Another one is participation in the school environment, in the home environment. But as speech therapists and OTs, we look at what do those kids need to be able to do and how can we help them be more independent.
All right, and diving a little bit deeper into more of the diagnoses that speech therapists treat, there's 2 columns right here in children and in adults. And for tonight's purpose, I'm going to really focus on a couple of these in the next slide, but I did want to include that there isn't ASD on here, there isn't ADHD. What speech therapy can help with are those like secondary things, how that personally affects them. Is it a speech sound disorder? Is it fluency? Is there the pitch a little higher? Like, we are able to help more with that secondary that seems to be a little bit more affecting and like just a little bit more difficult. But also I wanted to include that these don't just stand alone. Sometimes a kiddo can have an articulation and a fluency disorder, a receptive and expressive language disorder, and I'll talk a little bit more about that in the next slide. So just a little bit of the anatomy portion. The frontal lobe is often affected by ADHD, and the frontal lobe also plays a large part in speech and language. And that is why there's such a high correlation between ADHD and speech and language delays and disorders. Like I said, while we do not directly target ADHD, speech language pathology helps manage those secondary effects. And the two big categories I'm going to go over is that speech and that communication, also known as language. I put articulation disorder. Those are commonly known as your lisps, but truly any sound that you hear that is slightly distorted, we're able to help with. And then, like I was kind of talking about before, that variability in pitch, we can help bring more awareness to you raise at the end for a question, you keep it more flat for a statement, and as well as increase vocal pauses, repetition, and word fillers are more common in kiddos with ADHD, and those are our disfluencies that some people consider a stutter that we can help with as well. And then in the communication portion, there is both expressive and receptive. And even without a specific delay due to distractibility and other related symptoms, going off topic, finding the right word, and putting thoughts together quickly can ultimately affect that, even that grammatical portion of speech. And then the listening comprehension can be directly and indirectly impacted. While there could be no true language delay, receptively being that comprehension portion, we only have so much working memory to comprehend and manipulate the information heard. So often that can lead to missed details in both conversations and stories, which can ultimately affect both academics as well as building those social relationships and that reading comprehension. So ultimately in speech therapy, we teach those missed skills, improve on current abilities, build on the strengths they currently have, and create those successful techniques and compensatory strategies just to help life be a little easier.
Transitioning into chatting about OT scope of practice. So we'll chat a little bit after this about some of the things that both speech and OT target together. There's tends to be sometimes a little bit of overlap, and especially addressing some of the executive functioning skills in relation to ADHD. I'm going to kind of just give a very general overview on some of the skills that OT can target. So like I mentioned before, we really are looking at what that child and that family needs to be able to do to feel independence and success in their day-to-day life. So as an OT, I look at all of those different performance factors, specifically related to motor skills, including fine motor, visual motor, gross motor skills, looking at play skills. Is the client able to complete their daily activities? Can they get dressed by themselves in the morning? You know, are they able to sequence all the steps and get everything done they need to do in their schoolwork? There's a lot of things that we analyze as an OT that look at what exactly is the difficulty in that task. Is it because there's some fine motor difficulties? Is it because there's difficulty regulating their emotions during the task? So part of our jobs, like Emma mentioned too, of looking at the performance factors and looking at problem solving a little bit of, what are the things that are tricky and how can we improve some of those areas that ultimately improve the overall functioning. So this list is another just expansion of some of the fine motor and gross motor skills. So there's a lot on here. I won't read through everything, but there's a lot of things we work on in OT as far as specifically looking at what that client is having difficulty with in the school environment, you know, with dressing, with gym class, right? If there's difficulties with gross motor coordination, they're going to have difficulty participating in that group environment. So there's a lot of things we might do for assessment to really hone in on what areas we can target in OT, whether that's handwriting or upper limb coordination, ball skills, strength and endurance to be able to sit upright at the desk in school. Different things like that are things that we look at in the assessment process. This slide also expands a little bit on the visual motor skills, which also contribute to difficulties with reading if there's any difficulties with some of these visual perceptual or visual motor skills. These skills also play into dressing skills as well, many self-care skills in addition to handwriting as well. So those are big ones that we tend to work a lot on in OT. In addition to the basic self-care skills, thinking of dressing, we also can work on toileting, feeding in conjunction with speech therapy, and looking at those independent activities of daily living. So for the kind of those higher level skills, managing routines, planning and organizing, all of those kind of independent living skills, from meal preparation to, job applications, working through all of those different steps that are needed to live independently. Another big thing that we work on in OT is, and we also work on, but also in a sense, we really want to have a good understanding of that child's sensory processing skills. So without going into too much detail today on sensory processing, the main thing to note is that there's a lot more than our 5 senses that we were initially taught in school. So yes, those are important ones in understanding cues from our own body and the environment, but we also have some special senses. So those additional senses are our vestibular system, our proprioceptive system, and our interoception system. So our vestibular system helps with figuring out where our body is in space, and that information is given to us from our semicircular canals and our inner ear, and they register anytime we move our head. Anytime there's a position change of our body, our vestibular system is activated. With the proprioceptive system, those are receptors that are found everywhere throughout our body, in our muscles and in our joints. They also help with body awareness and figuring out how to move our body. So they definitely help us with coordinated movements as well. When talking about interoception, I'm talking about all of those internal sensations. So our interoception system are all of our sensory receptors that give us information about our hunger cues, when we need to go to the bathroom, all of those things that help us kind of regulate, including regulating temperature is another example of that. So in OT, we definitely want to take this into consideration and how that child processes sensory information from their environment and their own body and how that relates to their activities. So this relates directly to emotional regulation and also for being able to sustain attention to a task as well. So this is something we keep in mind throughout the intervention process, as far as coming up with strategies to help provide input that's going to help that child organize that information and ultimately be more successful in a certain environment, as well as getting a child to recognize their body cues in order to self-regulate as well.
Alicia talked a little bit about how we both are able to work on some different sort of skills, and it ultimately comes down to because we are able to help different underlying difficulties and weaknesses, and these things that we both target differently but ultimately impact the same skills are those social skills, executive functioning, play skills, and that emotional regulation. So to start with the social skills, on the language side, we're able to help create words and identify emotions, be able to do that cause and effect of why a person may feel that way, doing some inferencing. Well, I see they are sad, or I see they're happy, but why are they feeling this way? But also a huge portion we work on is that nonverbal language, that nonverbal body language, and those social interactions, including all those unwritten rules. And with distractibility or impulsiveness, sometimes it's difficult to not blurt out answers, to interrupt, to speak too loudly, to know exactly where your bubble is and where you're supposed to be seated to make everyone feel comfortable. And we're able to help bring that awareness as well as find comfortable and the best appropriate solutions for each kiddo.
Mhm. On the OT side of things, again, sometimes we might work closely with speech on this, especially with some of those understanding social situations. But being able to really figure out, like I mentioned before, what are those underlying skills negatively impacting their performance in social situations? Is it because they can't dribble the ball, that they're avoiding playing at recess, right? Is it because there's difficulties with that self-awareness, regulating their emotions? So we might work on different cognitive strategies in conjunction with speech, like the zones of regulation, teaching children how to read their body clues, working on some of those interoceptive skills to be able to understand, hey, I need to take a drink of water to self-regulate, then I can come back to the group. So there's a lot of different skills that we might work on that are ultimately going to support having social relationships.
And then, sorry, excuse me. Next is that executive functioning skills. So focusing on that core 9 of attention, working memory, inhibition, fluency, planning, organizing, initiating, shifting, monitoring, regulation. My favorite example for executive functioning skills as adults is going to the grocery store. You have to initiate that process, know that I'm out of food, I should go to the grocery store. And then creating that list, that planning, that organizing, that attending to your list and looking around and picking out the ingredients you need, being able to adapt and shift if they are out of basil, so you have to go find it in a different aisle, kind of those things. But for kids, it's in every aspect just as well, whether they are playing tag at recess, playing soccer, doing their typical like bath time or routines, as well as that academic side. And for speech therapy, can directly work on that attention. And then we also indirectly work on these things through higher level grammar, that higher level language portions, like the syntax, so how the words are put in a sentence, including that identifying differences, creating the representation of relationships and predictions of behavior. If I do this, then I can do this. Unless I do my chores, I won't be able to go outside. What could versus should means, those kind of higher level language skills, as well as the semantics, so that meaning, being able to create different categories, differentiate features, explore the variety of relationships and expectations, and ultimately form concepts. So with this higher level language, this expressive language, we're able to specify exactly what we need, what we want, clarify which item would work best, and exactly how we plan to execute any task. Like I said, whether it's asking a kiddo to play tag and how you're going to ask, or how I'm going to make sure I have my bath done and making sure that I have the correct temperature, because unless it's warm, I'm not getting in that tub.
That's a really good example, Emma. Yeah, great examples, again, describing some of those different challenges that when these executive functions are working well, right, we kind of take those for granted. They happen really quickly and fluidly. We can shift tasks, right? Thinking of multitasking, right? I can start cooking dinner, but then also talk on the phone, all of those different things that we really, when we're working with kids with these challenges, we want to make sure to really break down, like Emma mentioned, what specific area is it? Is it that the working memory piece is really impacting their school performance? Is it that planning and organizing piece? So this is an area that we definitely overlap in as far as addressing these skills. But on the OT side of things, looking at really that functional outcome, is it that they're having more difficulty with sequencing their self-care routine? And how can we support that? Is it through developing some external memory aids, right? Using visuals? Is it working on, school task completion, where we have to work on sequencing a multi-step activity, gathering all the materials, being able to plan and organize some of those things. I have a few more examples on this next slide here. So again, yeah, thinking of with those executive functions, the one that I think a lot of people doesn't come to mind initially is handwriting. It's a big task that involves a lot of different skills. It involves not only motor skills, right? Of course, thinking of the actual act of writing, so needing the strength, the coordination, and the dexterity, but it's also an executive functioning task. It requires pretty high level skill of being able to have the idea, to that ideation, being able to sequence and to execute and combine all of those thoughts into a motor action is a pretty difficult task for a lot of reasons. So not only that, but looking at an OT, that self-awareness piece, like I mentioned before with working on emotional regulation, can we self-reflect on the task after? Have, did we stay within our time? How did I do? Did I need to ask for help and didn't? Let's assess my handwriting. Do I feel like I followed the directions of the assignment? That flexibility and thinking as well. Those are things that are all part of many of those everyday tasks that our kids work on, specifically with a lot of the school tasks that can be pretty challenging. So thinking of, in general, just those intervention approaches we would use with not only kids with ADHD, but any of our clients we work with, is really working on, can we build that skill and increase their skill level? Can we create new skills that weren't there before, or promote the development or continue development across that developmental continuum? Can we establish new skills or restore lost skills? That's another intervention approach. Or thirdly, in conjunction with all of these, can we modify the environment to make it easier for them? Can we modify the task to make them more successful? Are there external memory aids or supports that we can provide them in different environments to be able to participate more independently at home, in school, and in the community as well? This slide describes a few things that we might look at when we're working with families. This by no means is an exhaustive list of all of the family factors we might consider, but just as a few examples, there's a lot of things that we want to really consider when we're doing an evaluation and getting to know that child. Is there, an additional language that client or the family speaks? Was there trauma at birth, in development? So we ask about a lot of these things with our intake packet to really gather all the information to get that full picture of the family in the client as well. So again, looking at, are they on medications? Do they have any comorbid disorders or different medical diagnoses? Whether it's, yes, having an ADHD diagnosis, but is there also, history of a head injury? Are there vision concerns? Anything like that, we're going to want to know to make sure that we're taking that into consideration when evaluating and treating a child as well. The other thing we want to look at is, what other professionals are they working with? So using Molly as an example here, right? Looking at, they're working with Molly, we're going to want to know exactly what they're working on with the family. Is there overlap? Are there things we can support if there's a specific area that they're already working on with that outside provider? Are they seeing a counselor? We're going to want to make sure that we're addressing things and using language that's supportive of the type of therapy they might be getting outside of OT or speech. A big one we really pride ourselves on at Sunny Days is making those connections with the primary care provider as well. Really keeping them in the loop with their progress, with our treatment plans, reaching out if there's any questions, and really, providing that continuity of care to make sure that they know exactly how the client's doing as well.
So what's next exactly in this assessment process? Specifically at Sunny Day, there's an initial kind of two routes. Yes, I noticed these things. I would like help with this. could go straight into an evaluation. And whether you give Sunny Days a call and we get a doctor's order, or you can reach out to your primary care and then we would be able to get a referral from them, or that this could maybe be helpful, but I'm not sure. Sunny Days does offer free screenings, and you'd be able to just come and chat for about 30 minutes. We'd be able to hang out with your child, hear your concerns, and then we could give you our best recommendations of we should do a speech eval, we should do OT, we should do both of them kind of options. And in that evaluation, as she kind of said before, we don't just look at one specific thing. We try to look at your child absolutely as a whole. We want to and work with you as a whole. We include our standardized tests. We include those standard scores that every insurance company needs, but we also want to hear how life is at home, what concerns you have, and what are your ultimate goals, because that is what we want to be able to have you achieve with our help.
So that wraps up our presentation today. I will make sure Molly has our contact info to be able to pass on our phone number and also our emails if you guys have any specific, questions about the presentation after we're done today. But I'm going to stop sharing so I can get my camera back here. All right.
Okay, well, great. Thank you. That was a lot of good information. I just think so many parents that I've run into just aren't aware that these types of services can help them on the journey. And so it's thank you for sharing all of that. And speaking of parents, we do want to give you the opportunity now to ask some questions, to pick their brains a little bit because they are experts in this, and you can certainly bring up some of the needs that one of your children may have, and wondering if that would be a possibility for help and so on. And also, I am open for any questions too in regards to some ADHD specific strategies too. So all you typically have to do on Zoom is just push down that space bar, and that unmutes you, and you can ask a question. So again, anybody feel free, if you want to put it in the message, I will take a look at that and share. Otherwise, you can unmute too and share any questions that you have.
Hi there, my name is Angie, and I already have a consultation done, or assessment done at the Albertville St. Michael location, but I was wondering, we get our results, I think, next week, but I was wondering, do you guys offer suggestions? My son has an IEP. He's had one since the first grade, and his peers and his caseworkers are really looking for recommendations how he can be helped at school. So do you guys do that too, as make suggestions for both teachers and peers how to better assist him with things at school?
Yeah, great question, Angie. I can start, and Emma, feel free to jump into with your experience. Yes, to answer your question, like I mentioned, we collaborate very frequently with outside providers, specifically school providers, quite frequently. So as far as kind of how that process looks, it really depends on what the needs are specifically in your case, Angie. We want to fill out a release of information if you guys haven't already, to be able to have that two-way communication, and possibly set a meeting with his school team, wanting to make sure we loop in, if he's already getting OT and speech, at school, we want to make sure we're communicating with his school therapy team as well. And absolutely brainstorming, coming up with different strategies in the classroom is something we do quite frequently, dependent on, the teacher's needs too. I know in my experience, sometimes teachers it'd be so great if they had this type of visual in the classroom. And I'm like, you know what, we're going to make that in our session, and I'll, laminate it and send it with you guys to take to school. So that's just a small example, but yes, absolutely can coordinate together with the school team.
Thank you.
Yeah. Emma, did you have anything else to add on that? Sorry, I didn't mean to.
No, that was perfect. I was about to say that we work very, very close to our clients' teams, and just to make sure not only are we able to help provide ideas, but we're all on the same page. A lot of the time will use the same visuals for my kiddos, or even the same layout of therapy sessions. So there's that feeling of similarity and understanding, and just so he's or she is comfortable in whatever setting, and just that familiarity of those visuals that help to know that it's always there.
Mhm.
Great, thanks, ladies.
Yeah,
You're
we're
welcome,
excited.
Angie.
You guys are getting started. Good.
Anybody else have any questions?
No question is too small.
No.
Hi, good evening. My name is Becky,
Hi, Becky.
and I am wondering if there's something can be done for kind of elementary age. I have a 7.5-year-old, and he has a lot of issues with, I think he has problems with his interoception, I think is what you were talking about earlier. He really does not read bathroom cues very well, and has a lot of issues with bladder incontinence. And I'm wondering if, I mean, obviously, we're thinking about going forward with like an assessment and things like that, but wondering if there's any information you can give me tonight that would kind of be helpful, and or things that you guys can do in therapy that could help with that.
Yeah.
Great question, Becky. And I'm just going to interject first, because I was surprised as I became more and more knowledgeable on ADHD that, you are not alone in having a child that's struggling with toileting. And it was, it's a thing that many kids are struggling with, many families are struggling with. And so I just want you to realize that it's not all that abnormal.
Well, thank you. That is very good to hear, because it is a very, it does feel like we're alone a lot of times, and that he,
Yes.
I know he's not doing it to misbehave. He's not doing it on purpose, but it does feel very personal and very much like it's our fault.
I'm sorry you guys are dealing with that, Becky. I know it's one of those things too that really impacts every area of life, right? You guys going out in the community, right? Those social experiences, and in the school environment too. So I definitely, would love to get you guys set up with an evaluation to really look at the whole picture. So kind of, again, without, delving into exactly the entire evaluation process, but one of the things we would look at is the sensory processing piece of toileting as well. So if, like you mentioned, if he's not reading some of those cues, there's things we can do to help build that body awareness, looking at the sensory systems, and also looking at the environment. Sometimes it's not only the physical piece of it, but it's also what's going on in the environment. Is it distracting? Is it that the dryer is too loud and that high frequency sound is really sending them into, high anxiety, and they're avoiding using the bathroom because there's certain things going on. Looking at what the routine is. Do they know what to expect? Different things like that, in addition to looking at, like I mentioned, the sensory piece, and looking at reflex integration is another therapy technique that can help with bowel and bladder control as well. So definitely would recommend, you guys coming in for an evaluation, and you can kind of talk through more specifically with the therapist some of the details too. But
Great, thank you.
We work with many families and kids that are experiencing issues with toileting. So you're definitely not alone.
Great, thank you so much.
Yeah, of course. Let's see, I saw a question pop up here.
Yeah, there was a question. What recommendations do you have for a child struggling with lack of appetite or slowly starting to eat a less variety of foods? And I did make a comment, speaking from personal experience with a child. What we had to do for our son was to use a lot of carnation instant breakfast in whole milk, and that really helped a ton in terms of weight gain.
Great.
And that was a good thing for us, and it has pretty good nutrients. But I know Emma, with your background in speech, I know that this is an area where a lot of people will talk about swallowing, and, you know, there's a lot of eating that's in that speech therapy area.
So, feeding evaluations as well, and that's one evaluation that actually the speech therapist and the occupational therapist do together. Otherwise, we do our evaluations separate, but it's nice because speech therapy works on like the mechanics. Is the flap in the back of your mouth not going up so it's coming out of your nose? Is it going into the lungs? Are we not able to chew correctly? Well, Alicia, please step in when I'm wrong, but more works on that texture, that variety, that feeling. So we're able to look at both at the same time to see exactly which of our specialties would work best with your kiddo. And even sometimes it's both.
Definitely. And I think this is a piece where we definitely, like I mentioned, with all of our clients working with that primary care provider, but especially with feeding, wanting to gather all of that info on, you know, BMI, growth charts, all of those things, and really pinpointing, you know, again, those underlying skills, like Emma mentioned, is it that there's some motor skill deficits? Is it that there's a lot of sensory concerns where we're going to work on different ways to kind of desensitize to those textures? So definitely would require, a lot of team approach on that to make sure that they're going in the right direction. But if you have any concerns about feeding, definitely feel free to reach out, and even, you know, you can give us a call, and I can talk with you further, you know, over the phone if you guys have more specific questions about, you know, if you think an evaluation is the most appropriate. We also offer free screenings as well. If you know, you're not quite sure if you want to move forward with the evaluation, that's just a 30-minute session. We'll get you set up with a therapist, and you can kind of talk through your concerns and then make a plan for next steps as well.
Yeah, and I know a lot of parents of children with ADHD, those who are medicated, you know, one side effect of some of the medications is that loss of appetite. So it's a big concern as a parent to see that your child's not eating, they're not thriving physically, they're not putting on enough weight. That's a big stressor. And so, that part isn't easy, definitely so. We did have another question come in too. What can we do at home to improve executive functioning? I'll just throw out something really general here, is that, you know, they need a lot of structure and consistency that you as a parent need to help guide and build in. And I think that, you know, there's specific areas that can be targeted that can definitely help, but, you know, I know through, you know, listening to these ladies talk tonight that there's specific things that they can do. And I know I've talked to a lot of parents about, like, sometimes you need a 504 plan for home. And that, you know, they can come up with 504 plan for home sort of stuff based on, you know, maybe an evaluation and stuff like that too. So I don't know if you two have anything more to add with any specific things that maybe an example that you've done or something like that. I'm sure you could share.
Oh my gosh. We could probably talk for forever about different therapy techniques. One of my favorite go-tos is an obstacle course. I think that's such a fun one to incorporate at home. Not only that there's, in Emma, you can jump into it, but just thinking of all the ways you can incorporate speech into that as well, but looking at sequencing, right? Okay, in that ideation, before we move our body, can we come up with a 5-step obstacle course at home? Okay, what's going to be first? Can we write out the steps first? That ideation, working on writing, being able to shift between tasks. Okay, what materials do we need to get to set it up? Okay, let's come back. You know, working on moving through all those steps 1 through 5 and doing it, you know, in a way that is moving slowly, right? And maybe giving different directions each time. This time we're going to move the speed of a turtle, right? We're going to move really, really slow. And then maybe the next time you run through the obstacle course, you're going to do it at a really fast speed, and working on changing speeds to work on that impulse control a little bit. So there's a lot of ways to modify that, but I think that's a fun one at home because you can really do an obstacle course with anything, couch cushions, you know, doing, incorporating a board game with pieces at the start and at the end, where maybe the goal is to get the board game piece and bring it back to the start every time you do the obstacle course. There's a lot of ways to modify it, but I'll let Emma jump in with anything else that she likes to do.
Yeah, also going back to the question about improving executive functioning at home, all those different core skills really do build off each other with a base of that attention. And kind of similar to, is the dryer too loud in the bathroom when we're trying to go? It's a huge thing is just looking at the environment. Is the TV on while we're trying to do this? Are the lights too bright? Is there something we can do to adapt the current situation to allow a focus to be more on one thing? But one of my favorite ways to just work on executive functioning is to print off a picture of a craft and be like, all right, let's make this. Because that initiation of, oh, I need paper and sequencing. I need to cut and I need to glue it. Reviewing. Oh, it's missing eyes. We don't have anything for eyes. Adapting the activity. Well, if we don't have eyes, then I guess we can use these chocolate chips, which may be weird on a paper craft, but and then it melts and they're like, oh, maybe the chocolate chips weren't a great idea. So allowing them that creative process to work through what does and doesn't work is also a great, not only fun activity to do, because who doesn't love crafts, but also works on so many portions of that executive functioning.
Right. And what I like so much about what both of you said, I mean, and it's just really what you're giving them is skill development. You're developing skills that maybe they need that support in that they're lacking, and they don't even know that they're in some of the activities that you were just talking about. They don't even realize that they're developing those skills, but it's really about that skill development. So that was great. We had another question here pop up. Son was just diagnosed at age 3.5. Should we start now or wait until he's school age? Is there success at a young age?
Oh, great question. Yes, absolutely. There's success at a young age. We definitely encourage, and, looking at research, early intervention really is key for so many of these things. And Molly, just like you mentioned with, really that focus on skill development, it's never too early to start, even if they're, you're unsure if they're on that trajectory. That's why we always want to do that evaluation first before we recommend a treatment plan, because maybe it's just that reassurance of, hey, everything's right on track, but let's give you guys some tools and strategies to implement to kind of keep facilitating that development on that trajectory we want to be able to set him up for success for kindergarten, right? So thinking of, for preschool, kindergarten, that school environment, what types of skills does he need to learn to be a successful participant in that classroom? So that's where, like we've talked about tonight, really analyzing what's developmentally appropriate, and also what are the demands of the environment? How can we set them up for success? So definitely would recommend getting started as soon as you feel like there's a need.
Right.
Yeah. And anything else on that? Sorry, I got excited to answer that.
I completely agree. I know I saw the question too, and I was like, I love early intervention.
Yeah.
Yes, I completely agree. And the younger we are able to help build those foundational skills just a little bit more to help with that next step in almost a less demanding environment than like a preschool and a school. I know that I have families come to me, they're like, do you think my kiddo will be ready for preschool because of XYZ? And I'm like, well, I'll start incorporating some preschool activities so it's one-on-one, less of a demand, but then they'll be more familiar. They'll be able to understand, oh, it's book time, I should sit here. And just being able to help at a younger age, I think is always a great place to start.
Yeah, I don't think any therapist has ever said it's too young to start. I mean, if some of you missed it at the beginning, I think you mentioned starting with or having to work with somebody who was 11 or a child that was 11 weeks old. So yeah.
Yes, exactly.
Not for ADHD.
Correct.
Anybody else have any more questions that they would like to ask or put in the chat?
Hi, this is Angie again. One more question. Do you guys have any suggestions? My son has a very slow processing speed. We found out when we did the mind print with Molly, And do you have any suggestions of things we can do at home to help them with that?
Ooh, that's a great question. Emma, do you have any kind of like speech related, accommodations that you typically work on or activities for?
I'm thinking right now that like with that processing, I do try to start in a quiet environment. A lot of this of our answers are just look at the environment, but I promise that's not the only thing we do. But I also like to start small and build on and create larger things, like start small with that auditory and that understanding. Miranda is here. Would you like to jump in at all?
Miranda is our clinical supervisor at Sunny Days. So I don't know if she's actually.
Oh,
there she is.
I'm hiding from my children.
Guest appearance. Miranda's also a speech therapist, in addition to being our our supervisor.
Hi guys, can you hear me okay?
Yes.
I'm happy to be here. In terms of processing, some quick tips that, once you do them regularly, you're going to think, man, why didn't I do this sooner? Physical proximity with giving directions. So try to give directions with your child in really close proximity to you. So avoiding, and as I say this, I've done this like 4 times in the course of this meeting, but avoid giving directions when your child's in the other room. Avoid giving directions in an environment that's not specific contextually to what you're talking about. So if you're talking about something in, food related, go to the kitchen. If you're talking about something routine, bedtime related, go to the bedroom or to the bathroom. It just helps center them in their focus, and understanding the vocabulary that you might be using is associated with that environment. Something else I love is a hand on the shoulder. So if you are looking to kind of help them, slow down, stop thinking about other things, decrease their processing time, just that simple, hand on the shoulder can help bring them more in environment. And then another one I like is just starting by saying their name before you give a direction, ask a question, and then you'll notice their eyes may come to you, may not, but you've at least given them time to digest, okay, someone's talking to me, versus could they be talking to someone else in my environment? So things like that help get their attention. And then wait time, I think, is the biggest one. It might feel like you're waiting a really long time, but you'll start to know periods of the day where you really require that wait time. So you might give a direction, ask a question, provide a comment to something they said, and then you can almost see the wheels turning. So just giving that wait time so that they can really collect themselves, but also have time for whatever you said to break down, go into their brain, build back up into a response, and then come out in whatever way they want to respond. So some of those simple things environmentally, physically, and wait time would be the biggest one, I would say.
Those are awesome suggestions.
Miranda.
Thank you.
Yeah, thank you. That's great, because my son is, go get your socks on. It's 15 minutes. So yes, a little more patience, and
Yeah.
Yes. Sometimes even, having some of those visual supports can help. I've used like a picture exchange system as well with kids. So you give them a picture of the socks, and this it obviously involves a little more prep. So it's not for like rushing out of the house time, but if you're looking to build those connections with, daily routines, go get your socks, and you give them a little picture of socks. So whatever they do over the course of getting, from where they started to where they need to be, at least they have the picture of socks. So it's like, oh, okay, that's what I'm getting once they get to the location. Keeping things in the locations that you would expect them to be is another big one. And limiting toys in the environment can also really help.
Thank you.
Yep, no problem. Yeah,
Thank
glad
you.
to be here.
Didn't know you were speaking tonight, but there.
I always like a good celeb shout out. No, just kidding. I
Yeah,
told them I was not going to be able to contribute in any way because my husband's working till 8 and I have my 1-year-old and my 2-year-old here with me. But
You're managing quite well. Well, we do
Oh,
have
thank you.
another question.
Who knows what they're doing?
Yeah. We do have another question that popped up, and it seems like here that somebody's asking a question. They've had their 9.5-year-old doing speech and OT or speech at school and OT at another location. And kind of talked about the areas of skills that they're struggling in: social, executive functioning, emotional regulation. And they keep talking about graduating out. How long you see kids for and how often. She's kind of feeling like he needs a little bit more, you know, and is it common to graduate at OT, or do you see kids long term?
Yeah, great question. It really is client and family dependent. I think we definitely see kids anywhere from sometimes 3 months, just one treatment period, and definitely sometimes we see kids for multiple years as well. It really depends on the needs of the client and the family. And in my experience too, a lot of that is, you know, figuring out, is there generalization of those skills too? Have we really worked on, you know, those skills carrying over into the home environment or across multiple environments? So yes, we have definitely, you know, have kids that we graduate and don't come back to therapy, but we also see kids that, you know, might take a therapeutic break because they've met a lot of their goals, things are going well, and then we might check in, you know, in a year or even less than that and restart services because there's new needs. So I think it's really a mix of short-term and long-term, depending on what's going on with that child.
Yeah. And then we have another question here that popped up dealing with emotional regulation, which all of us know is a big component of ADHD for many kiddos. They've been doing cognitive play therapy for a year and recently started Adderall, but still getting in trouble at school, lashing out physically and verbally. So wondering, is there help for emotional regulation?
Yes, absolutely. And yeah, Emma, feel free to jump in regards to the speech piece of this too. But again, looking at that evaluation process, you know, there's a lot of things that could be going on underlying that are, you know, a part of that. Is it because there's, you know, lack of impulse control? Is it because there's some sensory processing challenges going on? You know, do they understand the demands of the environment? What's that routine like? Is it, you know, the same structure every day, or is there something that's changing in the environment that's, you know, causing some anxiety? So as far as, you know, working on intervention tools and OT, that's something, you know, we work on individualized to that client, as far as, you know, working on mindfulness strategies, different tools we can work on to build that skill, and things that can be implemented across environments too. So definitely something we work on very regularly in OT.
I really enjoy working with OTs and working as a team with kiddos that are working on that emotional regulation piece, because when they work on that, I on my side also get to give them that language, and that language to give advocacy, language to identify. So working together is so nice. Like, oh, that's how my body feels. Oh, and this is how I get to say it. Like, it just works so well being able to work with OT and speech on that portion.
Yeah, good. Thank you for both sharing that. I think, as I said, it's a big struggle that many kiddos are dealing with that, and it doesn't feel good to them either to feel so, you know, out of control, really.
Yeah, definitely.
Does anybody else have any more questions? We have just probably time for one more here, and then we'll probably need to wrap things up. Well, we must have answered. Oh, no. Yep. Here we go.
Oh, that's from Miranda. Yeah. Yes.
Okay.
Yeah.
Okay.
Yeah, definitely.
Yeah.
If there's anything else, Molly has our, you know, our contact information and, you know, our phone number to the clinic too. If there's any questions, like I mentioned, Emma and I are both happy to talk through. Yeah. anything that comes up, or if you guys have any questions about the therapy process at all, we're definitely here to help and be a resource. So
Right.
don't hesitate to reach out.
Yeah. And I do, I'll be sending an email out tomorrow to all participants, all the people who signed up for tonight. And it's going to have Sunny Day's contact information, their website, that sort of stuff. So you'll be able to, reach out maybe for that screening. So there's, opportunity for that. I'll also be sending out, we do a free 20-minute consult too, or I do a free 20-minute consult. So, we've maybe brought a lot of possible solutions for you tonight. Sometimes we just need to do a little bit more digging to find out what can work best for your kiddo, because it's so common with ADHD. People will always say, if you know one person with ADHD, you just know one person with ADHD, because everybody is so different. And so we really, all of us want to work on helping the individual person with ADHD. So a big thank you to you guys for sharing all of your expertise, and thank you for the parents who joined us tonight. And again, you'll have my contact information, you have their contact information, and we hope that we can be a valuable resource to all of you in the time to come to help support your kiddo.
And
Yeah.
please feel free to reach out. I'm very much that person that after a presentation, an hour later, I'll be like, this was the question I wanted to ask. With our emails, it is never a bother. A question is never too small. Please feel free to reach out anytime.
Yeah, absolutely. Thank you guys for having us on and taking the time out of your schedules. I hope it was helpful. So we appreciate giving us.
Yeah, I'm sure that it was. Well, thank you everybody for joining.
Yeah.
Reach out to any of us if needed. Have a good rest of the evening.
Great. Thanks so much. Thanks, Molly.
Yeah. Bye-bye.